We now have radioligands that can be used in PET scans that can detect this material called amyloid that accumulates inside the brain. And certainly we find that Alzheimer patients show a positive signal for amyloid, whereas the control patients many times do not. But what we found was that about 20% of the people who were cognitively normal ended up showing positive for these amyloid scans. But sure enough, within 3 to 5 years, these were the folks who then converted to either mild cognitive impairment or Alzheimer's disease. And because of that, we now think that this is going to be a very useful screening tool. The available evidence, and it's accumulating very quickly right now, suggests that 5 to 10 years before the onset of symptoms, we can detect amyloid in the brain. And that this is going to be used for screening, much like cholesterol is used to screen for heart disease risk. This is going to tell us who's at risk of Alzheimer's disease. And we hope that this will really help us ultimately lead to the prevention of Alzheimer's disease. We identify those at risk before they get the disease. We find an effective intervention to slow the amyloid accumulation or reverse it, and you never get the disease. And we think we can achieve that before 2020.